evening, everybody, and a warm welcome to Scope's Parent Training Workshop Series. My name is Ashwini, and I'm one of the parent support specialists at SKN Foundation. Before we dive in, here's a quick intro to Scope. We are an initiative of SKN Foundation supporting South Asian families of children with disabilities through education, advocacy, and empowerment. These workshops are intended for general guidance, so please uh, talk to your own providers for advice specific to your family. Tonight we are tonight is all about navigating puberty and periods in girls with developmental disabilities. This workshop offers practical strategy, medical insight, and supportive tools to help caregivers feel informed, prepared, and empowered. Meet Dr. Priya Sareen Gupta, a board certified family and adolescent medicine physician and senior medical director at Mass General Brigham. She also serves as medical director for mobile health at MGH Craft Center and teaches at Harvard Medical School. Her work focuses on health disparities, social determinants of health, and improving care for underserved population. Through research and mobile healthcare model, Dr. Shareen Gupta aims to provide culturally responsive care to adolescents and families across diverse communities. Thank you all for joining the call today and welcome Dr. Priya. Warm welcome, and the floor is all yours.
Thanks so much, Ashley. I'm just going to share my screen and some slides. Awesome. And is everyone able to hopefully see this? So I'm here today to talk about periods, menstrual management in our adolescents, our teenage children with special needs. And I've prepared a few slides and then really hope to open it up to answer all of your questions
Uh,
that you may have in this topic. Today I will go into a little bit of what families, what you can expect. Also want to learn from you what some of your perspectives are so that I can help answer your questions. And then I will touch a little bit on some of the relevant issues, different types of medical management that can come into play as it relates to this topic. So, just as sort of level setting and background, something that many of you are maybe already familiar with, 5.2% of children in the US have a special need, 3% of the general population, and 1.2 million teenagers are affected with some form of cognitive disabilities from mild to severe. And teens with intellectual and physical needs may depend on others for their hygiene needs and getting this piece and supporting such teens in this space can really enable them to continue on with school in a way that's not disturbed. Perimenstrual behavior changes sometimes can prohibit normal activities and teens with special needs may not get that same robust conversation with their primary provider to discuss their concerns. So this is why this is really a space where parents can support. Just some big picture uh, factoids around specific disabilities, just for your awareness and general knowledge. So, children that have cerebral palsy or Williams syndrome or neurofibromatosis, spina bifida, are more likely to start puberty early and may also tend to end puberty later than typically developing children. So the median age of menarche, for instance, in teenagers with CP is 14 as compared to the rest of the population where it's 12.8 years old. Spinal cord injury can also have some implications as it comes to reproductive health. Children with autism and Prader-Willi may experience a delay in the start of their menstrual periods, as can children with chronic inflammation or poor nutrition. And Turner syndrome can sometimes present as primary amenorrhea, which means that their period is not starting in that age range that you would expect it to start. So just to give a big picture overview on puberty and really periods or menstruation as it relates to puberty. So and there's a lot of words on the slide, but just to highlight that there's a hormonal pathway in our body where that from our brain to our pituitary gland and downstream to our reproductive organs, and it relies on hormones, the pathway getting mature, and then hormones like estrogen, progesterone, stimulating another hormone, GnRH, that then stimulate another hormone, LH and FSH. And when this pathway has matured, that's when the changes that we see in puberty start. So when we talk about periods specifically, the question comes up: what is normal onset? So median is about 12.4 to 12.8 years old. And certain ethnicities, it's a little bit earlier, and it's preceded by breast bud development and also hair growth, pubarchy, in certain sensitive areas of our bodies. And all of this is occurring earlier than previous generations, and there's many theories around that. But failure to go from some of those early changes of puberty to the start of periods in a 3-year time frame is a reason for concern, and something to bring up with your child's pediatrician or regular doctor. Also, when we think about periods, because it's really important as parents to understand, like, what is a normal amount. So a normal amount when individuals are menstruating is changing pads or tampons at about 3-hour intervals, fewer than 21 pads or tampons per cycle, and seldom need to change during the night, and clots that are less than 1 inch in diameter, and that the patient is not becoming anemic from the bleeding that they're experiencing. And sometimes that that hormonal pathway is not mature, or there are some variations from the norm. And in those cases, you get some of these presentations of like abnormal uterine bleeding. And this year shows what is happening with the hormones in terms of the LH surge and the ovulation and the different hormones that go up and down on a monthly basis to lead to the menstrual cycle happening every month. So, in terms of menstrual irregularities, initially common in all teens, but by the 3rd year after a teenager starts having her periods, 60 to 80% have regular cycles. Um, since we're focusing on some of the needs of special needs patients, so seizure disorders, thyroid dysfunction, as well as what's called PCOS, can increase an ovulatory cycle. So, cycles that aren't following the normal pattern. And sometimes it's also important to note that, like if a child, let's say, has a seizure disorder or a thyroid dysfunction or something else, those symptoms can be exacerbated by the hormonal changes of the period. So, and we see this with migraines too. Like if you have migraine disorder, as the child or the individual, the female is approaching her period, she may be more symptomatic. And then certain medications can independently cause some changes in hormones, and they can start to mirror menstrual irregularities. And that's just secondary from some of these medications and some of these medications are things that our patients with special needs are on. So as parents, And really, as the individual who's starting to menstruate, things to think about is symptom calendars. And I lay all this out because it's important as parents to support our girls as they go through this part of their cycle every month. So in some cases, you may be managing sort of the symptom calendar for your youth. Also, thinking through medications that can affect, the menstrual irregularities that we talked about. Goals. So if there are, and this is something you would work out with the provider, but I'll go into some medication options where you're able to sort of control when the menstrual bleeding happens. And talking through, there might be times where it's interfering with activities, or there's concern about weight gains, or if there's seizure disorder, where you may put the patient on a medication to so that they don't get their period. And then considering physical limitations, and that really plays into the sort of the hygiene aspect of it, like what is the child with special needs able to do on their own, where they might need support, and how you may be able to enable the child when they're not with you, like in their school setting and things like that, to be able to support themselves. And then, of course, consider emotional and cognitive limitations and all of this. And then really partnering with the school to think about how the school can support um, your children. And and I'd love to. I'm looking forward to hearing all the questions that you might have. But some of the concerns that come up with caregivers and parents is, how to prepare the child. So there's a number of resources, and I can actually share them after this talk, Ashwini, with you if you want to share them with with this group. But folks have done studies and come up with things like menstruation kits and tip sheets and things like that, that can really be effective ways for you to communicate with your child, to contribute to prepare them for what to expect. There's questions around menstrual suppression, and I'll talk about some of the ways that we can do that. Really, then, if that's a path that you want to pursue with your child, it's something that you want to discuss in detail with your doctor. Sometimes it comes up like the caregiver burdens, and I think like education and preparation can really help address this piece of it. Types of products to use, and then school concerns. So, with children of special needs, in some instances, there are reasons to suppress menstruation, but we have moved away from preemptively suppressing menarche, because that can cause premature bone closure and affect bone density. But if the patient is able to discuss, it's important for this to be sort of shared decision making, whether she wants to suppress menstruation or is able to work with you and manage it. Other reasons that we look into suppressing menstruation is if she is in a situation where she's having heavy bleeding, or if the bleeding is resulting in anemia, if there's dysmenorrhea, if there's a lot of pain when she's having the bleeding. But when the medications that which are also the same medications that we use for contraception that we use for suppressing menstruation, can also sometimes lead to unscheduled breakthrough bleeding. So that's important to consider, especially if that unscheduled breakthrough bleeding is going to be more of a challenge in this situation where teens need assistance with hygiene. And for those that go down the path of suppressing menstruation, usually an average of 1.5 methods are tried before satisfaction is reached. And sometimes folks go down this path because there's this worry that the school won't be able to really provide the same support around this. But it is important to note that the menstrual suppression doesn't, decrease risk of abuse or sexually transmitted infections in future state. And it is like one way to manage menstruation for these individuals. And there's also other medications for specific symptoms that are really important to keep in mind. So, if your daughter is having pain, a lot of cramping or heavy bleeding, we often suggest NSAIDs. and like Advil, because it's used not only for the pain management, but it can, if it's used around the clock during menses, it can actually decrease, just the way that it works, decrease the amount of bleeding that that she is going to have. And then there are some other medications that are out there that can, that actually, like in Europe, have been approved to be over the counter, that can really reduce just the amount of bleeding. And some families find that helpful as they navigate menstruation in their children with special needs. And then in terms of like specific medications for suppression of menstruation, you have like the combined estrogen progesterone pill, which is sort of your combined oral contraceptive pill. It also comes in the form of like a ring and a patch.
One more pizza, take
Um,
it. Take one more pizza
there
today.
are some contraindications to this because there is the estrogen component.
Keep
So for patients that are on anti-epileptic medications, for instance, they can't go down this pathway. The sort of the safest method for menstruation suppression is progesterone only pills. And progesterone only pills are so safe that they're also available over the counter now, but there's different versions of it. It also comes in the form of a depot injection or an implant, or an intrauterine device. The big downside with progesterone
again.
only methods for suppression of menstruation is it's the estrogen component that stabilizes the endometrial lining. So sometimes when we put patients on progesterone only methods, they can get the breakthrough bleeding, which in patient with special needs can sometimes pose to be even more problematic because then it's unpredictable bleeding that they're having. So there's like pros and cons to all of these methods, and important to discuss with your doctor if you feel like you want to go down this path. And then just something to note, like, so there are uh, like I had mentioned, like some methods that interact with anti-epileptic drugs and other medications. So not all methods are safe for everybody. And when your daughter is having her period, you want to avoid certain herbal supplements, can increase bleeding risk and decrease effectiveness. So if you're doing any of these methods, then you want to avoid like adding on top of it like an herbal supplement um, to help manage symptoms. And then, as parents, it's really important to know like where you can partner with your doctor for all of this. So, the role of primary care physician or your pediatrician's role is to provide sort of this anticipatory guidance before the start of menses, to really discuss any concerns that you have. And so you should feel comfortable asking them questions around, also exploring pathways around menstrual management if you want to go down the route of any kind of menstrual suppression. So these are all things that are important to bring up at your visit with the pediatrician or primary care physician. Um, and then as it comes to your child, proceeding, they're starting a menstruation, here are some questions that might be helpful just to, and then you kind of have a starting point in what to sort of talk to your child about as it relates to this topic. So asking your child, like, do you know what a period is? If you do know what a period is, can you tell us what it is? How does thinking about getting your period make you feel? And what questions do you have about getting your period? So our children sort of, they get their information from all different sources these days, but it is important to partner with your child and so that you can provide them, information that's factual and accurate. And then this is what I was referring to. And some of these resources I can actually send so it can be shared with all of you. But there are you know, menstrual kits or resources like handouts that you can use with your child. So this is actually a handout that if your child, you can actually print it out for your child so that they can sort of help explain, and also it sort of lines up the steps that they will need to remember. So sometimes, and they've been shown in studies to be effective in patients with varying levels of special needs, where by very clearly sort of outlining what they can expect and what steps they need to remember can be a really helpful resource to them. And with that, I'll stop sharing and would love to open it up to questions and thoughts that you might have. Right, right. So, I mean, I think that, I mean, like, do I think that she needs to start wearing a pad every day now? No, right? But because even when she starts her period, it's going to start by some spotting and then, and then the cycles will regulate. But I think that, kind of keeping a little kit that's accessible. So, like in the bathrooms that she uses, putting one in her backpack is probably like a good idea. And then, I think from your perspective, if there's no other way that she can communicate, like checking her like underwear, well, or she might communicate like if she has cramping, she may communicate by like putting her hands on her belly or something like that. So uh, I think you'll have this like sort of window of time to be there for her to support making sure she has like the pad in place and things like that once her period actually starts. Yeah, and the other thing that correlates is like you as her mother when you got your period, that there is a correlation both for onset of like menarche and actually then on the other end
Mhm.
with menopause. So but as I mentioned, for there's a number of theories out there, but girls are getting their periods a little younger. Well, yeah, and it depends on what you feel comfortable with, but there's also now period underwear.
Yeah.
It's the brand Wuka. That's a safe one that doesn't have like you have to be careful with which ones you buy because you don't want to buy something that's going to have chemicals, but it's WUKA. That's like a European brand, so that could be a good option. The only thing with that is like, then, you have to wash it, obviously, once it's taken off, but it does sort of, I think it can help facilitate some of like the hygiene concerns that you're worried about. Yeah, and it might be if you go down that path to buy one of those and put it in her backpack at school too, and let the school nurse know that like, look, she has this with her, so if she needs it. Yes, they can. It can be, but she'll probably still get it within that 3-year window of when you first started noticing, like the breast buds and things like that. But with the development, it can be a reason for why you haven't seen her get her period just yet. Yes, the bedwetting at night that's not really related to the reproductive, like that axis of hormones and maturity that we were talking about. So that should be that's an independent. That's more related to maybe like her other developmental or whatever her the special need or disability is, but not related to this. By repeating, maybe if she's observing you sort of do that, then that might normalize it for her. So like if the first time it happens she's watching you, but being present and watching you sort of wash whatever out, then she might be feel more comfortable than doing it herself. Behaviorally, like role modeling what you'd like to see her do. Physiologically, she's had her period for long enough that it should be regular. But periods,
Mhm.
we often forget they're like a vital sign, right? Just like our blood pressure or other vital signs, our heart rate. And so sometimes when we go through phases where periods are irregular, it could mean that something else is going on that needs to be worked up. It could also be like, and it could be something as simple as, like I don't know her weight, um, but what I would do is I would start by seeing her primary care physician or her pediatrician, and they'll be able to initiate like an initial workup and then decide if further workup is needed. it is like the mood swings, like that is part of premenstrual syndrome in
Yeah.
everybody. And often, and then so what we've often sometimes with our special needs children, we or girls and or adults, it might be leading into their periods that you put them on something to stabilize mood, that so a
Mm-hmm.
medication, some kind of pharmacotherapy. The other option, and something that's like sort of well-known management for premenstrual syndrome in general for the general population also is putting them on an SSRI, so putting them on those medications that we use to, for instance, typically used to treat depression that you might have heard of. And what that does is it will just sort of stabilize the mood, and then you may not see the changes. But if it is very sort of short-lived and acute behavioral changes right before a period, it's not unreasonable to talk to your doctor about something that could just like help stabilize her mood just in those few days. Yeah, it is. It's an appropriate option, 100% for somebody if you want to avoid getting the regular menstrual period. And I think the question about it sort of relates about finding like a gynecologist that speaks to families with special needs. So I practice up in Massachusetts, so I don't know many in New Jersey, but there's two sort of specialties you could think about. One is to go down the path of trying to find a gynecologist that feels comfortable taking care of adolescents. The other is adolescent trained, medicine trained physicians like myself. So like in the New Jersey, New York area, it would be the academic medical centers that have adolescent medicine divisions. And if you were to reach out to them, they would also know of community folks in the community that can help you. When I take adolescent medicine call here in Massachusetts, we get consults from everywhere, from even our community practices. IUDs are safe. It's a misconception that IUDs like affect future fertility or future in any way. So the biggest challenge with an IUD is just tolerating the procedure of having it placed. But they are very safe methods, and now there is the Skyla IUD, which is the actual device that goes in is even like a smaller, so it's a little bit more comfortable for the patient. And it was sort of made so to allow, historically when IUDs first came out, it was for folks that had already given birth. So this is like a smaller unit. So IUDs are very safe, and there's no, I know one of the questions is there a better age? There's no age like cutoff age where you have to be to get an IUD. Yeah, I mean, I think the safest is the NSAIDs, like that you're at taking Advil, and but just really, most people don't think necessarily of doing this, but taking it sort of around the clock, like every 4 to 6 hours in a regular cadence during that time, not just, once a day or something like that. If you want to see that effect of it decreasing the amount of bleeding. And then the other things that you can do is get an IUD or get on a progesterone only pill, like actually suppress menstruation. Yeah, so I mean, first of all, like, yeah, just rest assured that these are very, very safe
Yeah.
medicines. The if she's on the combined, estrogen progesterone pill, I mean, your own body makes estrogen and progesterone, right? So, I think what sometimes happens is, let's say you're on it for 5, 10 years, the endometrial lining builds up so much that then you
Mm,
start having breakthrough bleeding anyway. So what we'll do is sometimes it might be like, let's say after 5 years you may go on a holiday from it just so that the lining can all
okay.
completely shed, and then you can get back on it. Then, or you might, there's so many different ways that you can manage it. Or you, instead of getting back on the OCP pill, maybe that's when you'll say, okay, she's older, let's just put an IUD in. An IUD can stay in
Mm,
for 10 years. And then
okay.
that's more local. So you may then at that time pursue maybe a different method, maybe a method that right now, you didn't consider, or you considered, but it wasn't what was ideal, but then will feel ideal. They're generally safe
Okay.
medicines. And
Okay.
so, I think that you made the right decision based on what
Thank
you're
you.
saying. Melatonin is not, yeah, that's okay. That's not one that I've heard of interacting with. Yeah, so I think beyond the period underwear, and I have no interest or connection to any of these products, but I've just found them to be useful, and in research that I've done, they don't have the like some of the chemicals that we also don't necessarily want to expose our children to. But I think beyond period underwear, I think the idea is if you're going to go down the path of like pads, you just if they're going to be away from you for a good number of hours, let's say when they're in school, you want to get something that's, if it's a pad, you can get something that's more higher absorbing so that you're covered and you prevent leaks and things like that. It's certainly like a sign, like it's part of the pubertal changes, and then it's hard to predict in how much time she will get her period. Everybody is different, but of course, not having seen her as a patient and not having seen the discharge, there is some physiological discharge that looks white that precedes, you know, the start of periods, and also just even on a monthly basis, individuals will notice that. It really like, so your pediatrician, it really depends on your pediatrician or your primary care physician's comfort level. So for some folks, they just, you can continue to see the pediatrician or the primary care physician for all of these sort of reproductive needs, and they only go to OBGYN in future state when they are trying to conceive, or are pregnant or something like that. For other, it just really depends on what the comfort level of your current provider is. There's no like fixed age when you have to start going to an OBGYN, because a lot of the screenings and things that are recommended for the reproductive tract, many and most primary care physicians and pediatricians can also do. With that, it just really depends on the ability of the individual to use it. It's a little bit more involved than just putting a pad. So just depends on, it's not
Yeah.
recommended, but it might be a little bit more nuanced than just sticking with
Yeah.
a pad.
Yeah.
I see
Hi,
one other
Ashwin.
question. Sorry, I see doctors mentioned in autism, puberty is generally delayed. How many years of delay on average? So it's a couple of years, but again, that really varies from individual to individual. Yeah, so I mean, the amount of menstrual bleeding and the period pains, that's really more at the level of your body, that hormonal pathway that I showed the slide of. So it shouldn't, so it's going to be independent of that. But once she does get her periods, if she does feel, it does feel like in what you're describing, she may be someone that you may go in the direction of menstrual suppression if needed. But it's hard to tell, of course, without knowing her full history and everything like that. But the not being active piece is probably not correlated with how much bleeding
Okay.
she has. Yeah, but that's not to say that she shouldn't be on those medications, because that's more important that she be on those medications. But it
Yeah.
might be that if you do go down the menstrual suppression route, that you will choose something like an IUD or a progesterone only pill or something like that. But the controlling of the seizures is more important than the
More
impact that
important.
it would have on her periods. Yeah. I see maybe a question to the parents as well. Anyone's kids still not potty trained and approaching adolescence to the doctor, how do you manage the situation? So again, this is so unique to each individual patient and their individual sort of special needs. So there, I would say work closely with you know, with the doctor that the patient has, who understands that patient to figure out how to manage that situation. And then, can any supplement during period be helpful, like iron? Um, so, and addition, I mean, I think you want to make sure that your daughter is eating well, that they're getting the iron that they need. Because certainly, when you're menstruating, you're losing some blood. But there's no recommendations for any specific supplementation. And we generally say, they can take a multivitamin, especially if you feel like they're not eating as well. Sometimes as children, even when they're going through adolescence, they become a little bit picky eaters for brief periods of time. So then you can sometimes supplement, right? And if you feel like giving, children with special needs, sometimes also there's if you're feeling they're not getting a well balanced diet. But we always say the best way to get your nutrition is through the actual foods that have the nutrition. And then the secondary way is through vitamins.
Doctor, I have a question. I don't have girls on the spectrum, but you mentioned that there are some supplements that you should avoid. Can you talk about that?
Yeah, so that was specifically around if your daughter is taking something for menstrual
Oh,
suppression, you want to avoid things like St. John's wort and certain supplements that you'll see out in the market for menstrual symptom management, because those supplements can interfere with how effective the hormonal like the OCPs are, or the progesterone pill is.
yeah, yeah, that makes sense. Thank you so much. With that said, thank you so much for taking the time to talk to us. Dr. Priya, you shared such a wealth of information, and also patiently answered all the questions that our families had. Um, we appreciate, this is such a difficult topic for a lot of families, and we are so happy that you took the time to answer all our questions. Thank you all for the family who were robustly grilling Dr. Priya, had your questions answered. Awesome. Thank you all for joining us tonight.
And I'll just share my email again, so feel free to reach out if there's any ways that I can support you or guide in the future. So thank you so much, and
Yep.
really wonderful to meet all of you.
The mission of SCOPE is to support South Asian families of children with special needs through activities that educate, advocate, and empower. For more resources and upcoming sessions, subscribe and follow SCOPE.